Welcome to our postoperative care video. Jessica is our clinical lead in the office and sees patients and really runs our clinical side of things. I'm Nick Slenkovich, Denver Body Doc, board certified plastic surgeon.
So you just got home from surgery, now what? You're gonna be all groggy, you're not gonna know what's going on. That's why it's really important to have a good support person.
Yeah, caretaker is key here. It can be intimidating for the caretaker though. I know this. I'm a surgeon and I've also been a caretaker and I'm going, what do I do, honey? You've had surgery. Oh, but you're out of it. She can't remember much. And here I am working to try and figure out all the medications, all of the instructions. So it can be confusing. You've got resources though. First of all, give yourself some grace. Likely things will be okay. If you really do freak out, call us on the phone. However, going back to the instructions we've given you, ideally your caretaker has been able to come to your pre-op appointment and get those instructions. That's super, super helpful if we can do that. You will get the hang of it after that first night, the next day, etc. You've had a bigger surgery, it's likely you're coming back to see us the very next day.
All right, we're gonna check through, see how your pain is doing, check to make sure your skin is healthy, see if you're eating, drinking, going to the bathroom, all of those things. If it's a smaller surgery and you didn't have to come in, then I'm gonna give you a call and ask you all these questions, see if you have questions. We're here for you.
Absolutely. Healing's a tough one because sometimes it seems so easy, other times it's harder than you think. You're best to be prepared for it being harder than you think. Most people haven't gone through the surgery you're planning to go through previously, so you don't know what to expect. You're going to be sore in areas that you didn't realize you'd be sore, and it can certainly take many weeks longer than you might have thought to kind of get fully back to yourself, not realizing what it's like to be tired at the end of the day or to have sore spots in areas that are still tight.
Right, and everyone's going to heal a little bit differently. Everybody's pain tolerance is going to be a little different. So that's why it's important that we have this partnership between our patient and us so that we can come up with a plan that's going to be best suited for you.
Yeah, and we're here the whole way through. You're listening to this, you're preparing is a big step in that. Afterwards, we're here as well. Your massage therapy appointment is a great starting point. Our massage therapist, Pam, works through light touch, is getting the tissues moving right away, but it's also hands-on every area that we've operated, working the lymphatic system and identifying any issues that may be going on that are specific to you. And so now, between Jessica, our nursing staff, Pam, our massage therapist, myself, we're working with you to come up with, hey, what does it take to get you to the next step to get you to recovery?
And we'll give you homework with with massaging. It's just all part of the partnership so that we can give you the best results.
Right, and so there's no stupid questions, right? If it's happening for you, it's happening. Let us know. We're here. Some people will send in pictures for us to look at if they're from out of town. Maybe give us a call or an email. So there's multiple ways you can reach out to us. And of course, we're always here if you need to come in for an extra visit. So someone's got swelling, and what happens at 6 weeks? Is everyone fully healed at 6 weeks?
Oh, not even close.
You certainly can be a long ways there.
Right.
However, you feel like maybe you're around third base and you want to be home, you're tired of being in recovery phase. So it can be that we still have an extra push to kind of get there even after 4 to 6 weeks. And let's say maybe body contouring or rhinoplasty where we know there will still be some visible swelling because it's right in the center point of our face where a small amount of point is visible. If it's facelift or your ears or breast, still at 6 weeks we may not have the final result for sure, even if we're maybe long ways towards an early result and really loving what we see, but we can't always judge. So along those lines, what about looking in the mirror and judging where we're at in that early recovery period?
It's really important not to be hyperanalyzing until at least 6 months because there's going to be a lot of healing left to do. When you feel into your tissues, if you did lipo around your trunk, there's still going to be some stiff areas that maybe are a little bit tender to touch.
Yeah. You'll notice dramatic changes. And so one of the benefits we get, when we get you back, we're able to put up your pre-op pictures and you go, I get it. I see the big change, even though there may still be a little puckering of the incision. Sometimes little sutures will spit out that are absorbable sutures that haven't absorbed yet before they get to the skin. Sometimes small little wound issues where the skin hasn't fully healed primarily. You know what? All those are possibilities. This is surgery. There is always the possibility, and we do see all of those things from time to time. And there's always a possibility that we may need to do some revision or touch-up procedure. It varies by the procedure, the complexity, the person, but we can't control everything in that healing period every time. Feeling like this video is a little bit of a downer because it is so much fun to participate in the care of our patients. We love seeing them back, smiling, telling us, hey, I can look in a full-length mirror for the first time, or I love my nose, or whatever that is. But we do want to prepare you for the fact that there's work, and sometimes there are bumps in the road on that way to recovery, and it's not a straight line. What are good things to be thinking about?
That sometimes the recovery can be an emotional roller coaster. You're going to have highs where you're super excited that you're done with surgery and you can see in the mirror that your stomach is flatter, or whatever surgery you had, you can see some of those results. But as the days tick on, sometimes it gets really frustrating.
Other days you may be tearful and cry. You know what? That's okay. Give yourself permission for that. Know ahead of time that that is reasonably common and it is temporary. You're gonna get better and feel stronger. So if you feel like shit, you feel like crying, you feel like, why did I do this? Why was I vain? I spent money on this. Know that we see that. It's not surprising. It can be a common part of the recovery experience.
I tell patients one day at a time, this too will pass. But it's important to know that a roller coaster might be coming.
Yeah. Exercise. We got a lot of people that love to exercise and they've worked their butts off to get there in a great place to where they're a better candidate for surgery. So afterwards, when do we start exercising?
It's important to remember getting your blood pressure or heart rate up for at least 2 weeks, 3 weeks if it's a larger surgery. And so at 2 weeks, if it's a smaller one, you can start to slowly begin to get back into that routine.
Basically, you can walk as much as you'd like at first. After 2 to 3 weeks, I think some light aerobic activity that doesn't get your blood pressure up, is not super intense, is okay. Usually at a month for most procedures, provided your healing is coming along normally, we release you to whatever your body allows you to do without too much discomfort. You do need to listen to your body.
If it hurts, don't do it.
Yep, I'm pretty practical about that. I like getting people back earlier than later. I don't want you to decondition. I want you to go ahead and get back to your activity because I think it helps your recovery in general. But you can't overdo it, and there are some procedures where we'll have specific limitations, say for breast augmentation and use of the upper body and the arms. So it's important when we give specific limitations for lifting or upper body use, whatever that may be, that we follow those specific restrictions. Hope this video has been helpful. Certainly give us feedback or ask us additional questions if you have them. For Dr. Nick and for Jessica,
We're here for you, and we look forward to meeting you in the office and being a part of your journey.